I am currently leading a home health quality assurance team. We deal with different medical records that are submitted and done by our NPs and PAs. We make sure that all of the records, all of the services that are rendered by the home health and by our company are defensible, medically sound, and necessary. So I'm used to audits. I'm used to making sure that everything we do makes sense and would bring the best to our patients. I am also in charge of the team that I handle. I do onboarding, I do training, I see and check if there are gaps in the processes and if there are things that can be improved. I check if it's a problem in the process itself, if it's a problem with the team member, and see how coaching can be done. If there are a lot of things to do and everything seems to be needed to be done at once, I make sure that I look at the deadlines and see which really needs to be done first and go down the list. Of course, if something is medically urgent, that will be something that is the top of my list. As a registered nurse, I value client safety, patient safety, and ensuring that the patient is really given the care that they deserve and that is most appropriate to them. Secondary to that, of course, would be keeping our clients happy, making sure that everything is, as I said, defensible and sound, and nothing is, as the question said, falling through the cracks. I deal with reviewing progress notes that our NPs, PAs, or sometimes MDs submit to us before we give them to the home health. So I check everything is if everything is clinically sound, if all the medications have their corresponding indications and diagnoses, and vice versa. If anything is amiss, we bring it up to the NPs or the visiting provider to question them and see where the lapse began, and we correct it. If need be, if outside provider verification is needed, I am also the person in charge to call and get in touch with these offices and get to the bottom of it. I have requested progress notes, medical records from hospitals, pharmacy lists, medication lists, to make sure that the data and the information in our progress notes is accurate and as complete as possible. But I do feel that when it comes to scheduling and coverage management, it's a very interpersonal type of thing and not so much clinical like progress notes. So, with that said, I really want to see what type of providers we have and prioritize as well their needs, their preferences, and make sure that these are communicated as well to the home health and to the clients, to the patients. I am a believer of patient education and basically letting the patient and our clients know exactly what they're in for, what to expect. So I think that carries over in scheduling and coverage management.